So Dr. An has an internet connection issue, so he's trying to fix it.
Great. And welcome everyone. We'll get started in just a minute. Thank you for joining and hold tight for another minute or two.
Excusez, hein, j'avais perdu la connexion là. Docteur Anne, je suis revenu. Allô?
Ok, oui, alors docteur Anne,
Allô?
voilà, merci. Voilà, excellent. On t'entend maintenant. Tu es maintenant dans...
C'est bon. Hein?
Alors, est-ce que tu es
Est-ce que
connecté?
vous me voyez? Est-ce que vous me voyez actuellement?
Non, 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 on ne te voit pas. Alors, pour te voir, regarde, quand tu regardes en bas de ton ordinateur, il y a des icônes qui sont là-bas. Il y a une icône sur le micro et tu vas voir, il y a une deuxième icône sur la vidéo. Alors, tu cliques l'icône sur la vidéo pour l'activer. Est-ce que tu parviens à le voir?
C'est activé. Quand actuellement, c'est parti. Quand je fais ça,
Non, 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 là, on ne te voit pas du tout. Hein. Ça n'apparaît pas. Est-ce que c'est l'icône de la vidéo que vous avez activée?
Okay, we're gonna get started. Welcome everyone. Yes. And I know we're still working on a little connection issue, but hopefully Omar and Dr. Sheikh, you can chat via the chat function too to make sure everything is functioning. So welcome everyone to our third in our series on government agreements. Sorry, Omar, do you want to translate quickly to Dr. Sheikh?
Oui, bon, docteur, donc, alors ce qu'on va faire, c'est qu'on va démarrer, parce que le temps est... Voilà, nous avons déjà démarré. Maintenant, ce n'est pas grave par rapport au problème de la vidéo. Donc, on va essayer de démarrer les présentations.
Docteur Sagna, docteur Sheikh.
OK.
Donc, on a démarré les présentations. Donc, je ne sais pas si on peut le suivre. On est d'accord?
Okay, wonderful. Thank you. As you can tell, we have, and we will have some French translation happening later in our session. So apologize for some of our technical issues in the beginning, but ready to jump in. Again, this is our third in our series on government to government, USAID government to government agreements. And today we're going to focus on G2G design and co-creation. Next slide. So just quickly to go over some procedures for the webinar, we'd love it if you can put in the chat your name and your country name so we know who's on the line and what countries you're calling in from. This recording and the presentation will be sent around to all the attendees afterwards, and it will also be posted on the ASAP website. You can see it listed there. So if you want to share it with others or look at it later, you'll have that. We ask that you use the Q&A box for any questions that come in. That way we'll have a record of all of the questions. We'll try to answer some of those as we go. And if we can't, we'll hopefully have time at the end to address them live as well. If you'd like to speak at the end during our Q&A session, please raise your hand. There's a little icon at the bottom of the screen that says raise hand. So please do that and we can then unmute you if you're wanting to ask a live question during our Q&A section. And at the very end, we'll also have a quick poll to get some of your feedback on the session and ideas for future sessions. Next slide. And thank you all for putting in your country and your name and where you're calling in from. Thank you for sharing that. So as a quick overview of the session, we're going to do this welcome and then jump into an overview of the design and co-creation process of a G2G agreement. That will be led by Anna Tamazi and myself from USAID Washington. And then we are so thrilled to have colleagues from our program in Senegal and from the Ministry of Health in Senegal share some of their real experiences in design and co-creation. Senegal has had an immense experience doing government-to-government agreements, and we're so lucky to have them on to learn from their work. In Senegal, we're going to be joined by Dr. Omar Sanga from USAID Senegal and Dr. Sheikh Khan from the Ministry of Health in Senegal. And then at the end, as I noted, we'll have time for questions and discussion. Next slide. As we noted, this is the third in our series on government-to-government agreements. Our first session focused on an introduction to USAID government-to-government agreements. There's a link there to the recording. Our second session was focused on risk management and with specific lessons from Malawi, Ghana, and Jordan. And today, again, we're focusing on design and co-creation. Our last session will focus on implementation and lessons on implementing a G2G agreement. Next slide. So with that, I will turn it over to Anna to talk through some of the policy and big picture guidance on designing and co-creation for USAID government-to-government agreements.
Thank you, Debbie. Next slide, please. We're going to very briefly talk about how USAID looks at co-creation. And well, before we start with the panel presentations, we just wanted to kind of set the stage on how we define co-creation at USAID and how this concept has evolved over the years. Over the years, USAID has used a diverse range of modalities to consult and engage with stakeholders and partners. We've used the terms like co-design and co-develop, co-creation almost interchangeably. But recently then a current emphasis has been emerging in the agency, and the new tools and methods to co-create are taking hold, and USAID as a whole is thinking more strategically and purposely about what we mean by co-creation and how we can approach it different from before. So here is the definition that USAID is currently using at a working level to define what we mean by co-creation. Basically, co-creation is an activity that brings people together to collectively produce a mutually valued outcome using the participatory process that assumes shared power and decision-making. And the emphasis is on the mutually valued outcomes and the shared power and decision-making. Co-creation allows different stakeholders, including the donors like USAID, implementers, and beneficiaries and others to engage actively and bring their full set of capabilities and strategic goals to bear. In addition, it provides a channel for USAID and its partners to network and share expertise, and allows for a more equitable distribution of both the responsibility and the ownership of the outputs or results that we are after. So through co-creation, USAID can go beyond learning from various stakeholders about their needs and interests to a more interactive and ongoing engagement with those that are affected or hold influence over a specific issue. Next slide, please. And as I mentioned very briefly, there are lots of ways to collaborate during an activity. And it's important to know which one of these you're doing. So, because not everything is co-creation, and you might need to co-create and you might not need to co-create in every situation. You can generate new solutions, partnerships, and define problems through a variety of collaborative approaches. But when you think about co-creation, refer back to the definition that we just shared, because there is some degree of power sharing and decision-making with others that often distinguishes that type of modality from other tactics listed here on the slide. Next slide, please. Key principle that USAID conducts programming relates to the emphasis on the sustainability and the system strengthening as the means to sustainable development. That is why a key element of the design process is that we engage with local actors so that we design projects and activities that align with their needs and aligns with the needs of the system themselves. Furthermore, we also allow the local partners to lead these design efforts so that they own and sustain these results. This helps, this hopefully will help to promote the local ownership and local systems improvements. And it also constitutes a big change for the way USAID operates, being from a donor to a partner. By taking the lead, our partner governments drive their own agenda, drive their own learning process, drive their implementation. So that is why we think that these are key in promoting the sustainability and strengthening of the systems in which we have these activities. Next slide, please. And the way we do this, the way we try to promote that principle of local sustainability and system strengthening is by focusing on locally led approaches, connections with our partner governments, and responses to the context changes in partnership with them, in conversations with them. We engage with partner governments and stakeholders to bring them into our design and implementation processes so that they own and sustain the results that we are after. We co-define the problems that exist in their countries. We examine, we recognize that there is a key role that partner governments play in the local system, and examine that role so that we examine that role to understand how they fit within the boundaries of our system, meaning the boundaries of the theories of change and the wider system and design that we establish to achieve the results that we're after. So they have a key role in that, and recognizing that key role makes them a key stakeholder. So by recognizing their key role, we also try to emphasize the power that co-creation brings in engaging with them, in supporting the partner-led needs assessments, what they think is important for their own countries, how they think about what is relevant or needs a support. We listen and engage with them to understand their needs, but in order to support them, and how our expected changes in these partner government systems contribute to the changes at the system, at the country as a whole. So these are all factors that will be key by engaging with partner governments. These are all factors that will be key into how we measure performance and keep track of these system changes that we are supporting for improvement. Next slide, please. And the way we do this is through the government-to-government agreements. Government-to-government agreements are conceived as part of the co-creation and co-design process, which requires negotiation and trust. They serve as a mechanism to gather perspectives and make continuous decisions with our partner governments, where to focus efforts and resources. And they serve as a mechanism to co-define our problems and co-create solutions to fit the country context, to leverage domestic resources to maximize these outcomes, to use and strengthen partner government systems and sustain the outcomes, to support shared priorities, to invest sometimes in partner government own priorities, and align our own priorities with theirs. Next slide, please. And the government-to-government agreements are an activity that have a life cycle on their own. So the co-creation process can happen at every step of the way in this activity life cycle. Even before the planning of a government-to-government activity, conversations with partner government counterparts on how to best align our efforts are always present, as I mentioned, in the other ways of how we engage with them, not just through co-creation, but collaboration, coordination. Those are also ways that we, even before starting the co-creation by its own definition, are ways we engage with them. So with that, there are 4 general stages particularly useful for co-creation at USAID's processes, which we can embrace to use for engaging with partner government in co-creation. At the planning phase, once the eligibility for entering into an agreement has been established, securing that government commitment is an opportunity to initiate the co-creation process. Whether this co-creation means to start with co-defining the problem we want to address and share the same understanding on what needs to be addressed, or whether it means for us to take on an idea that the partner government already has and have a conversation about on how to move that forward and have a conversation on how that will support the system, the partner government system in sustaining what it's trying to achieve. So the co-creation can help identify, explore, validate, or refine a problem or support a government initiative. It also, through this process, it also aligns with the partner government priorities in doing so, because whatever they bring in as an agenda, whenever they bring their agenda to the table, they bring their priorities, and we align our priorities with their priorities. During the design phase, we look at how we can identify new and existing solutions. Co-creation convenes people and partner government entities to help develop those solutions that improve the areas that they have identified for needs, for support. And so they kind of identify these solutions that will be co-designed together and will be sustained, implemented first, and sustained and owned by the partner government, other partner government entities. It builds consensus around these areas for action that they narrow and it builds consensus around narrowing down what is the focus of the proposed solutions. And so by building consensus around that, it also helps in sharing the responsibility for achieving those results. The part of that process in the design space is also creating milestone plans and capacity development plans, which are very important on one hand to ensure that we are measuring towards success, but on the other hand, to ensure that we are supporting the weaknesses in the system to lead us to that success. Costing of the milestones of the agreements are also a key part that can have a significant impact into how the activity is being designed and negotiated to achieve the success that we are after. During implementation, there are many aspects to whatever has been agreed upon in the G2G agreement that both the partner government and USAID share responsibility for achieving with ownership from the partner government side. Closeout may seem like not as important, but I think that the closeout process of a government-to-government agreement is as important as the planning and at the start of one, because this is where you basically record, you basically look at the lessons learned, and you look at what have you achieved and what can you improve further in what you have achieved. It also is an important process for transferring knowledge to the partner government and its own entities in sustaining and owning the results that you've worked together on. So that is all in a nutshell on an overview part, Debbie, and off to you now Thank you.
Great. Thank you. Next slide. So we're going to talk just a little bit more about the co-creation process within design phase of a government to government agreement. Next slide. Anna covered a lot of this, but we wanted to just emphasize that it really is about an equal partnership. And once a country, once USAID and a partner government have decided to move forward with a government to government agreement, the co-design process starts, and there is a big emphasis on ensuring that we have mutually agreed upon objectives. Often stakeholders will come together, sometimes in a workshop, to make sure there's time to go through and discuss together what kind of objectives and even activities that we want to jointly accomplish. Next slide. There are typically two types of agreements that we often use for USAID government to government awards. The first one is called a fixed amount reimbursable award, a FAR, or sometimes referred to as a FARA, F-A-R-A agreement. These kind of awards are very output driven, and they're reimbursed and paid based on the output or an associated milestone. This can increase slightly the risk on the government side, the partner government side, because you need to accomplish your milestone before you're getting the payment. An example of this kind of award or an example of this kind of milestone might be achieving a health target or an HIV or other kind of sector target. For instance, a certain number of people who have been tested for HIV or provided services for different technical work. So that is the first type of agreement. Another type of agreement that we use often is a cost reimbursement agreement, a CR, and that is more input driven. So reimbursed based on the costs. And this can increase the risk to some degree for USAID because we're paying based on a cost, not necessarily the outcome achieved. An example of this kind of agreement or an output for this is, or input for this is supporting salaries for healthcare workers or different staff, procuring equipment, for instance, purchasing a computer or some sort of equipment needed for the work to move forward. And we've seen in many cases that countries use a combination of both kinds of agreements, depending on what the outcomes that they're hoping to achieve. This can be done even with the same government partner, and at the same time where you'll have both a fixed amount reimbursable agreement and a cost reimbursement agreement with the same partner, with the same timeline, and signed together as sort of one package. Next slide. So USAID and the partner government will be negotiating throughout this process and determining together many components of the agreement, including the milestones. So whatever the indicators or the targets to be achieved or the outputs, this could be the number of people to be reached or a percentage of a population to be served. This will also include the estimated completion dates, so when a milestone should be accomplished. There will be agreement on the payment amounts for the costs associated with the milestone, and agreement and discussion on what the final risk mitigation plan is. And if there are any measures that need to be addressed prior to the signing of the G2G agreement, or the timeline for when different measures will be completed. And finally, there's also coordination on the verification forms or systems to be used to assess completion of any of the milestones or outcomes. Next slide. This is just an example of a milestone table that is discussed and negotiated and worked on during the planning phase for a government to government agreement. These can take many forms, but here's an example you can see for an HIV related G2G agreement where we're looking at number of people tested these indicators and the milestones can be pulled from global indicators, or in this case, a particular PEPFAR indicator. And there can use systems that are already in place that can collect the data. It doesn't require setting up any new systems. Ideally, you're building off of things that are already in place that can be then used to collect the data and verify the results. And we've also highlighted here the costs that are calculated based on unit expenditures, and then any particular resources that are needed in order to achieve the milestone. And again, these are all negotiated and discussed with between USAID and the host country government. Various stakeholders go back and forth on these over many months to determine what the right indicators, what the right verification method is, and the right costs related. And timing, of course, is critical for this too. Next slide. So just to sort of summarize here this process for milestone and costing, that often these activities and milestones are jointly drafted with USAID and the partner government. USAID often will prepare a draft of the unit costs and then propose that to the country to begin that conversation and negotiate those. The partner government will review that and determine if that sounds appropriate, negotiate with USAID if any changes are needed. And finally, there's this final table of milestones and the payment amounts that have been agreed upon by both parties. So, we note that this is a process that can take weeks, sometimes months, but that it is really critical that everybody agrees to what the milestones are, understands the activities associated, and is supportive of the costs and the timeline for achieving those milestones. And that ensures, more successful implementation as the award moves forward. Next slide. And here's an example. Again, these can take various forms, but here's an example of a verification form that can be used to review what happened, ensure then this gets submitted to ensure the payments are made. So for a fixed amount reimbursement award, or the FAR award, there are milestone verifications that's based on the results achieved. For a cost reimbursement award, there's activity verification to make sure that that's based on actual costs that have been incurred. And then payments are made, that triggers payment. In some cases, advances are allowed under a USAID G2G agreement, and that is something that would be agreed upon ahead of time. And in some cases, if a milestone isn't met, there may be circumstances, especially in the last year and a half, we've had a lot of circumstances that have come up related to COVID, where there may be challenges with achieving some of the milestones. And so there can be a review and an update to some of those milestones if there are some circumstances that have arisen that prevented achievement of the milestone. Any revisions, of course, would need to be agreed upon by the partner government and USAID together to update. Next slide. So that ends my section, and I am so thrilled to hand this over now to colleagues at USAID Senegal and the Ministry of Health in Senegal to share their experiences with co-creation and their long history of doing government-to-government agreements in the health sector and really beyond. And bear with us, we have French translation for part of this section. So we will start with USAID, Senegal, and then hand it over to Dr. Sheikh Khan from the Ministry of Health. So first, over to you, Omar from USAID Senegal.
Merci. Merci, donc nous allons vous présenter donc les leçons apprises sur le processus de co-création entre l'USAID et le ministère de la Santé et de l'Action sociale du Sénégal. Ça, s'il vous plaît.
Allô? Allô?
Oui.
C'est Dr. Sagna qui commence à présenter avant Dr. Sheikh.
OK, d'accord.
Si je me trompe, merci.
Merci.
Yes. Okay, thank you so much. So thank you, and ladies and gentlemen, good morning, good afternoon, depending on the country you are. So we are very happy with the opportunity you give to us to share our experience in the co-creation into G2G. So I will provide this presentation with my colleague, Dr. Shekhan. This section will be divided into two portions. So the first portion will focus on the overview of the G2G that I will present, and my colleague, Dr. Anne, will focus on the second section regarding the co-creation. Slide, please. So USAID Senegal started the implementation of the G2G in line with the aid effectiveness agenda and principle as highlighted in the Paris Declaration of 2005, the Accra Agenda for Action of 2008, and the Busan Partnership of 2011. It is also in line with the USAID policy, especially the ADS 220. Senegal mission had a long history and experience in the design and implementation of G2G since 2011 with the National Malaria Control Program, the NMCP. The health G2G budget represents around 9% of the total USAID health budget in 2020 and 62% of the G2G total obligation in the mission. Slide, please. So our long journey and experience in the management of G2G can be divided into three waves or three generations. So the first generation covering the period from 2010 to 2014. During this period, so we have two tracks of G2G in process. The 5 central FARAs managed directly by USAID. As you can see, our first generation was very centralized approach as all our G2G beneficiaries are the central government of Senegal entities. At regional level, so we have the fixed amount agreement, the FAA, implemented by our, managed by our implementing partner. So at the end of the first generation, so we conducted an evaluation, and based on the lesson learned from this first generation, we move forward to the second generation. Slide, please. So the second generation covering the period from 2015 to 2018, and the key principle of the second generation is the development of the G2G roadmap providing a clear short-term, mid-term, and long-term vision, as well as the definition of our priority. The second generation was also a starting point to the decentralization of G2G in Senegal, beginning by a pilot including 1 central entities and 1 regional entities into 1 G2G agreement. This is what we call mini mega FARA. The engagement of the key department at the Ministry of Health, especially the Direction of Finance and the Direction of Planning, was a critical step to transition in the use of the PFM system of the government of Senegal, as well as the tipping point of the co-creation. As a result of the strong coordination and collaboration, the G2G line item and the G2G risk mitigation line item are codified in the national budget. The use of the fixed amount award managed by our implementing partner was used as a mechanism to support the transition from the FAA to the G2G. As you know, the FAA was a mechanism used in our mission to build the capacity of the region based on the PFMRA finding to support the transition of this region from FAA to G2G. The development of on-demand wraparound TA, GOTAP, is one of the key pillars of the second generation. And one of the objectives of the G2G wraparound TA, GOTAP, is to support the management and to facilitate also the management of the G2G in the health sector. Slide, please. So at the end of the second generation, so we conducted another evaluation, and based on the findings and the lessons learned from this second generation, so we move forward to the third generation, starting in 2019, with the consolidation of all the G2G agreement into one implementation letter. This is what we call the Megafara. The third generation was also a starting point to increase the role of the local government in the management of G2G at regional level, as well as the mobilization of the local resources using the matching grant approach. Based on the lesson learned from the GOTAP in the health sector, the mission decided to develop on-demand cross-sectorial wraparound TA, the G2G Ops. And one of the objectives of the G2G Ops is to support the mission to standardize and to harmonize the development of the G2G across the sector. Lastly, the mission has developed a G2G reference guide providing resources and tools required to the management of G2G, as well as the key training tools used by the mission to build the capacity of the staff working into G2G. Slide, please. So what did we learn from our long history and journey in the implementation of G2G in the health sector? So we learned that the co-creation is a fundamental for the success of the G2G, and the four key pillars are very fundamental. The first one is the preparation of the co-creation, focusing on the development of the standard term of reference with a clear objective, expected outcome, timeline, and also the modality to conduct the co-creation. The identification of the key actor at each stage of the co-creation, at USAID side, at partner government side, is also essential. The success of the co-creation will require a strong coordination within and across the sector. For example, in Senegal, before going to the co-creation, so we organize what you call an internal preparatory meeting. And the objective of this internal preparatory meeting is to make sure that all USAID staff are on the same page and we are delivering a standardized and harmonized message during the co-creation. Last but not least, the success of the co-creation will sometimes need a strong partner government, socio-cultural, political, and economic environment, especially when this co-creation will require the participation of the high-level leadership at the government of Senegal. And at this stage, the role of the FSN is very critical and fundamental to make sure that the communication we are provided is adaptive with the social cultural context of the country, as well as to make sure that the communication will be conducted with tact and diplomacy. This is fundamental and key for the success of the co-creation. Slide, please. So right now, we're going to move to Dr. Cheikh Anne, our G2G focal point at the Ministry of Health. Dr. Cheikh Anne, donc tu as la parole.
Voilà. Donc, merci à tout le monde. Donc, nous vous remercions donc, de nous donner l'opportunité donc, de parler, d'échanger avec vous sur les leçons apprises dans le processus de procréation. D'abord, il faut retenir que c'est un plan qui est en 4 parties. D'abord, un rappel sur le financement direct G2G. Puis, nous allons parler du processus de co-création. Ensuite, les leçons apprises et enfin, les défis. S'il vous plaît. Hello?
Oui, hello. So on the lessons learned presentations, that are being conducted by Dr. Sheikh. It will cover 4 areas. A reminder on the direct financing, G2G. We have co-creation process, lesson learned, and we round up with challenges. Over. Next slide, please.
Donc, en matière d'introduction, nous pouvons dire que le G2G se développe dans le respect des orientations stratégiques du plan national de développement sincère et des objectifs du document pluriannuel de programmation des dépenses. Également, que c'est la gestion des ressources mobilisées sur la base de la dette d'exécution s'effectue conformément aux procédures du gouvernement du Sénégal à travers le système national des finances publiques, le système de prestation des marchés, le modèle de procédure du programme national de développement sanitaire, le système de suivi et d'évaluation, le système d'audit et d'inspection, et enfin le système de planification.
So the G2G is developed making use of 2 key documents. You have strategic orientations from the National Program for Social Development, and then objectives of the multi-annual expenditure programming documents. Meanwhile, resources mobilized from this in the implementation letter, the management of the resources is conducted in line with various procedures and systems of the government of Senegal that include the National Public Finance System, procurement system, monitoring and evaluation system, and the planning system. Next slide. Over.
Donc, nous avons 2 objectifs qui sont suivis. D'abord, il y a la contribution à la réduction de la mortalité maternelle et infantile. Et ensuite, il y a la contribution à la lutte, à la prévention et à l'élimination du paludisme. Ce sont les 2 objectifs du G2G.
So for the 2 objectives of the program, the first has to do with fighting mortality, reducing mortality at both maternal and infant level. And then there is also the fight against malaria, fight prevention and elimination of malaria. So those are the 2 objectives of the G2G project. Next slide, please.
Au niveau du cadre institutionnel, nous avons 3 instances. Il y a le comité de pilotage du financement direct qui est en stade des orientations stratégiques, mais également, ce comité assure le suivi de la mise en œuvre du G2G.
So for the institutional framework, organs responsible for managing the G2G project, we have the steering committee at the national level, we have the technical secretariat for direct financing, and then there is the regional validation committee. Allez-y, Dr. Sheikh.
Il y a le secrétariat technique du financement direct qui est en charge de la validation du paquet de la lettre d'exécution, mais également la validation des milestones du niveau central. Et au niveau régional, nous avons le comité régional de validation qui est en charge de la validation des milestones du niveau régional, mais également du suivi de la mise en œuvre du G2G au niveau de chaque région.
Okay, so for each of these organs, we have the steering committee, which is at the national level, is responsible for the strategic orientation. Then there is also the aspect of the monitoring of the project. Then for the technical secretariat is responsible for validation of the award amount in the implementation letter, and then also validating milestones at the central level. And then at the regional level, there is the regional validation committee, which is also responsible for validating milestones at the regional level and also ensuring proper implementation of G2G direct financing. Over. Next slide, please.
Donc, au niveau des domaines d'intervention, donc, le projet intervient sur la santé de la mère de l'enfant, de la mère, du nouveau-né et de l'enfant. Au niveau de la planification familiale, la santé de la reproduction des adolescents et des jeunes, le système d'information sanitaire, la lutte contre le paludisme et la couverture maladie universelle.
So the project covers 6 areas of intervention. We have the maternal, newborn, and childbirth, family planning, reproductive health for young and adolescent people, health information system, the fight against malaria, and the universal health coverage. Next slide, please.
Au niveau des zones d'intervention, ce que vous voyez en vert, ce sont les régions de consolidation, donc qui sont précisément dévolues pour les interventions G2G. Mais actuellement, au moment où l'on parle, les G2G interviennent au niveau de 3 régions. Et c'est depuis 2015 à travers une zone pilote qui est la région de Kapoum. Et en 2019, la région de Ziguinchor. Et cette année, en 2021, la région de Kaolack.
Okay, so what we see here, these are the zones of intervention. We have zones of concentration where the performance indicator is above the national average, and then we have zones of consolidation. So at the moment, there are three of the zones, one with 4 districts. That is the latest one, Kolak, from 2021. And then we have the other one with 4 districts, Kafrin. That was from 2015. And then we have Zengche-Ho with 5 districts. That is the area that started implementing the G2G project from 2019. Over. Next slide, please.
Wow. Par rapport au financement, donc, il y a 5 étapes. Ces 5 étapes, nous allons les développer davantage pour voir au niveau du processus de co-création quelles sont les attributes impliquées dans ces différentes étapes. Il y a l'étape de cadrage d'abord, puis qui est suivi de l'étape de négociation, puis il y a l'étape de la signature de la lettre d'exécution, ensuite l'étape de la mise en œuvre et enfin l'étape de clôture.
So for the G2G financing cycle, there are 3 steps. We have framing of the project, the negotiation phase, signing of the implementation letter, the implementation proper, and then the closeout. So those are the 5 steps of the G2G financing cycle. Next slide, please.
L'étape du processus de co-création. D'abord, il y a la première étape.
Next slide, please.
L'étape de cadrage. D'abord, il y a les critères de transition qui ont été définis. Ces critères de transition, donc, ils ont permis donc de déterminer les régions à financement à FARA vers le G2G. Puis il y a une validation conjointe de ces critères et leur application. Puis il y a la lettre d'information, n'est-ce pas, qui notifie les enveloppes hein, pour le ministère de la Santé et de l'Action sociale. Au niveau du ministère, donc, il y aura des discussions qui se feront en interne pour pouvoir faire la répartition donc, des enveloppes. Et enfin, il y aura une validation conjointe de la carte de répartition par bénéficiaire. Également, il y aura une élaboration, n'est-ce pas, d'un chronogramme par l'USAID, puis une validation conjointe de ce chronogramme à travers les étapes que sont la DPRS, la DAGE au niveau donc, central, également il y a les régions pour le ministère de la Santé et de l'Action.
Okay, when it comes to framing of the project, there is first of all this the first area which has to do with definition of the transition, the criteria and the application. And then the next has to do with the notification of award and then discussions at the level of the ministry on the award amount. And then there is also joint validation of how this amount will be shared per beneficiary. And then you have the last aspect of it has to do with the activity calendar, which is being drafted and validated by all the actors. Next slide, please.
Puis la deuxième étape, c'est l'étape de négociation qui contient 3 sous-étapes. D'abord, il y a la préparation et la planification conjointe que nous allons faire à travers donc, après, le déroulement d'un atelier, puis une validation conjointe avec des acteurs qui sont au niveau central, donc les directions centrales, au niveau des régions, les autorités régionales, et au niveau des autorités régionales, les collectivités territoriales, les comités de développement sanitaire, les autres partenaires qui interviennent au niveau de ces régions-là. Ce qu'il faudra retenir, c'est que tous ces acteurs participent à l'ensemble du processus de négociation. C'est-à-dire que, par exemple, ils donnent leur avis sur la maquette de présentation, également ils donnent leur avis sur le déroulement, mais également sur la validation. Donc, ce qu'il faudra retenir, en tout cas, c'est une approche collaborative et participative.
Okay, so just nothing that the negotiation phase takes place in 3 phases. There is the aspect of planning and preparation, drawing up the terms of reference, and we have the second phase, which has to do with the second phase, which has to do with. Please, I would like to have the slides on. Allô?
La troisième étape, c'est l'étape de signature de la lettre d'exécution. Donc, cette lettre d'exécution est déjà élaborée au niveau de l'USAID. Puis, il y aura une revue du draft de la lettre d'exécution par le gouvernement du Sénégal à travers donc, le ministère de la Santé et le ministère des Finances et du Budget. Puis, il y aura une intégration des feedbacks, n'est-ce pas, du gouvernement du Sénégal. Et ensuite, à la fin, cela va aboutir à la signature de la lettre d'exécution. Avec comme partenaires, n'est-ce pas, qui sont impliqués, l'USAID, la direction de l'ordonnancement des dépenses publiques à travers le ministère des Finances et du Budget, la DPS et la DAGE par rapport au ministère de la Santé et de l'Action sociale, et les régions médicales. Dominique?
Sorry, Dominic, just to clarify, are we on stage 2 or stage 3?
Ah, donc, OK. Donc, par rapport à la mise en œuvre, je peux continuer?
Attendez une minute, Dr. Chak.
OK.
Dominique, vous pouvez m'attendre, Dominique?
I believe we've lost Dominique.
Oh là là. OK. Alors, je vais essayer de traduire. Peut-être Omar.
Yes, exactly. So I can jump in and waiting, Dominic. So the third stage is related to the signature of the implementation letter. So there is three stages on this signature. So we have first the draft of the implementation letter by USAID. And when USAID will finalize the draft of the implementation letter, so they share this draft to the governor of Senegal, who will review, provide feedback. And the last step of this stage is, the integration of the feedback and the signature of the implementation letter. And all the actors are really involved in this process. The Ministry of Economy and Finance, the Ministry of Health, and also the region beneficiaries. Slide.
Donc, la quatrième étape, c'est l'étape de la mise en œuvre. D'abord, il va débuter donc par le partage, n'est-ce pas? Un acte de partage de la lettre d'exécution qu'on appelle le post-award. Ce post-award au niveau des régions, il est présidé par le gouverneur en présence des services déconcentrés et des bénéficiaires. Et au niveau central, il est présidé par le secrétaire général du ministre de la Santé et de l'Action sociale. Ce post-award va présenter les dispositions standards qui sont dans la lettre d'exécution, mais également les dispositions spécifiques qui sont en annexe de la lettre d'exécution. Mais également, il va insister sur la gestion des risques environnementaux. Et en marge de ce post-award, il y aura la signature des contrats de performance entre le bénéficiaire principal et les sous-bénéficiaires. Par exemple, au niveau de la région, le bénéficiaire principal, c'est la région médicale, et les sous-bénéficiaires, ce sont les districts et les hôpitaux. Donc, après ce post-award, donc, il va y avoir des revues conjointes trimestrielles qui permettent de faire le suivi du cadre de performance, d'évaluer le niveau d'atteinte des milestones, de faire le suivi de la mise en œuvre de post-remboursement, de partager les plans de travail trimestriels, mais également de faire la programmation des missions de vérification et des côtés de vérification par GOTA. Et enfin, également, au cours de cette mise en œuvre, il y aura la validation des milestones et de post-remboursement. Au niveau des régions, cette validation se fera par le comité régional de validation et au niveau donc, central, cette validation sera faite par le secrétaire technique. Avec au niveau donc tous ces acteurs, au niveau de chaque sous-étape, il y aura donc les acteurs du niveau central, les acteurs les autorités régionales, qu'elles soient administratives ou sanitaires, les collectivités territoriales, le comité de santé et de développement sanitaire, les autres partenaires techniques et financiers qui interviennent, n'est-ce pas, au niveau des régions, l'organisation de la société civile, les services techniques déconcentrés, comme le pôle de la direction de passation des marchés.
Okay, so the implementation, so we are not right now talking about the implementation stage, dividing into three steps. The first step is the organization of the post-award workshop, and during the post-award workshop, so we share the standard provision and the specific provision of the implementation letter. So we discuss about the requirement regarding the branding and also the communication requirement. We discuss also, the environment risk management requirement, and this is also the opportunity in the government side to start the signature of the performance contract between the region and the district. The second step of the implementation stage is the organization of the joint quarterly review. And during the joint quarterly review, so we discuss about the performance of the project, the study of the milestone completion, the monitoring of the cost reimbursement implementation. We share also the quarterly work plan developed by the beneficiaries, and also we try also to develop a mission verification plan. And the last step is the joint validation of milestone and cost reimbursement through the regional verification committee at regional level and the technical secretariat at central level. And during this validation, our beneficiaries provide the presentation of their milestone delivery. So they present also, the country verification report provided by GOTAP, and we provide the last validation of the milestone and cost reimbursement, and the final step is a transmission of this deliverable and supporting documentation to USAID for payment. And all the actors at the Ministry of Health, the Ministry of Economy and Finance, and also the civil society organization are also involved in this process. Next slide.
La cinquième et dernière étape, c'est l'étape de clôture. D'abord, tu vas débuter par une maquette de présentation qui est partagée, d'abord, par tous les partenaires, discutée en amont avec l'ensemble des parties prenantes. Donc, et c'est lors d'une revue annuelle conjointe, n'est-ce pas, que nous avons que chaque partie prenante va présenter donc, son bilan. Et à travers toutes ces informations, elle va nous permettre, donc toutes ces informations vont nous permettre d'élaborer donc le rapport final de performance. Et enfin, après ces rapports final, n'est-ce pas, il y aura la clôture de la lettre d'exécution qui peut être administrative ou administrative et financière. So et tous ces acteurs, ce sont les mêmes acteurs ce sont les acteurs du niveau central, les acteurs du niveau régional, les partenaires techniques et financiers, les organisations de la société civile, les services déconcentrés. Donc, tous ces acteurs donc, sont partie prenante par rapport à la torture.
Okay, so the last stage of the direct financing cycle is the closeout step. This closeout step started with the organization of the joint annual project review involving all the stakeholders. And at the end of this review, so we develop what you call a performance report. And this performance report will be used, to start the administrative or financial closeout of the implementation letter. So depending on the stage, for example, you are. So normally the administrative closeout is, if you are, for example, in the first year of the implementation letter. So the first year you can start administrative closeout, and the financial closeout will be conducted at the end of the project. And all the actors at central level and regional level are also involved in this process. Next slide.
Donc, maintenant, quelles sont les leçons apprises de la co-création? Il y a d'abord le renforcement de l'appropriation et de la responsabilisation des acteurs.
Slide, please.
Donc, comme je disais, il y a le renforcement de l'appropriation et de la responsabilisation des acteurs. Il y a la facilitation de la mobilisation de ressources domestiques à travers donc, la ligne G2G et la ligne risque de mitigation du risque, mais également au niveau local par le financement des collectivités territoriales à travers le marché. Il y a également, comme apprise de la co-création, la considération du partenariat entre le gouvernement du Sénégal et l'USAID, mais également cette co-création va faciliter le dialogue et l'échange, surtout dans la mise en œuvre des réformes, et des politiques. Par exemple, si je peux donner comme exemple, au niveau de la mise en œuvre, il y a l'accompagnement de la mise en œuvre des réformes des finances publiques et du budget programme. Également, il y a l'accompagnement lors de l'élaboration du plan stratégique de la planification familiale.
So in terms of lessons learned, so what we can identify is that, for example, that the co-creation will improve the ownership and the accountability of the government of Senegal actor in the management of G2G. It's also contributed to facilitate the domestic resource mobilization at central level, especially the G2G line item and the risk mitigation line item, as well as the mobilization of local resources using the matching grant with the local authorities. So the other lesson learned is that the co-creation can contribute to consolidate the partnership between the government of Senegal and USAID, and it also facilitates the dialogue and exchange between all the stakeholders, specifically in the implementation of the reform and policy. And as an example, we have the PFM reform, as well as the decentralization of the public financial management. Slide.
Également, il y a donc, il faut retenir aussi que la co-création a permis un cadre idéal de résolution des problèmes à travers les différentes instances que nous avons. Et comme, par exemple, certains problèmes comme dans le retard du transfert des paiements, n'est-ce pas? Également, comme autre problème, comme autre résolution, il y a le plaidoyer dans la contractualisation ou le recrutement de ressources humaines. Également, comme autre résolution, c'est-à-dire un plaidoyer dans la réhabilitation et l'équipement, n'est-ce pas, des infrastructures sanitaires.
So just to continue regarding the lesson learned from the co-creation. So the co-creation is an opportunity, for joint problem solving through the different framework put in place at the government of Senegal regarding, for example, the regional verification committee, the technical secretariat, and also the steering committee. The co-creation is also an opportunity to adapt to USAID assistance regarding, the context and the existing skills and expertise within the partner government, and also the necessity of a good understanding of the partner government environment is also a key for the success of the co-creation. slide. Okay, next slide.
Mais il faut également retenir, il faut également retenir que, la co-création aussi a permis donc à l'USAID de s'adapter avec les compétences et l'expertise au niveau du pays. Comme par exemple dans la capacitation et l'accompagnement en matière de passation de marché et accompagnement dans le processus de vérification des cost remboursement. Par rapport donc aux défis, il y a d'abord comme défi l'alignement sur le calendrier du gouvernement du Sénégal. Autre défi, c'est la notification des enveloppes dans les délais. Également, il y a un autre défi, le troisième défi, c'est le guide de qualification des rôles et responsabilités et les attentes de chaque acteur à chaque étape de la co-création. Ça, il faut retenir qu'au Sénégal, cette question est réglée dans la lettre d'exécution avec l'intégration d'un dispositif qui définit les rôles et responsabilités aussi bien de l'USAID que du gouvernement du Sénégal. Également, le dernier défi, c'est la disponibilité d'outils stabilisés, acceptés par tous les acteurs dans le processus de co-création. Comme, par exemple, la définition comme dans l'élaboration des maquettes de planification, dans l'élaboration des maquettes de visualisation et également à travers la checklist de vérification.
So as the key challenge of the co-creation, so we can identify, for example, the requirement for the alignment of the G2G, of the USAID calendar with the government of Senegal calendar. Sometimes we know that our budget cycle is not aligned with the host country cycle, and this is, a challenge that need to be addressed. The timing of the notification of the envelope is also, a key challenge. So the identification of the key role and responsibility, and also the expected role of each actor in the co-creation process is also a very important challenge. The development of the appropriate tools that will be used, during all the co-creation process. For example, the tools that will be used, for example, to develop the budget, to develop the verification checklist, to develop the annual planning are also, the key challenge, to ensure the success of the co-creation.
En tout cas, ce qu'il faudra retenir, en tout cas, est que nous savons bien que l'USAID est exigeante par rapport aux performances. D'où donc la réussite de la co-création a permis donc de définir les forces et les faiblesses, les forces et les limites du partenaire, mais également de mesurer les attentes par rapport aux performances. D'où un certain équilibre entre l'effort qui est fourni par les bénéficiaires pour atteindre les performances et les limites du système. Ceci donc nous a permis de minimiser les risques de blocage dans la phase de négociation de la co-création. Je vous remercie.
So the co-creation, required that USAID and the government of Senegal focus on the performance, and this is very important for the success of the G2G. So thank you so much.
Thank you so much to both Dr. Sheikh and Omar and Dominique for translating. Thank you, Omar, for jumping in on translation. I think Dominique is back on and can help with translation. For a couple questions, please, if anyone has questions, put them in the Q&A box, or feel free to raise your hand on the icon, the button below, and we can call on you to ask your question live. One question that came in was about the co-creation process. I think this would be a good question for Dr. Sheikh. You noted some of the challenges, but are there any other challenges you would like to highlight with the co-creation process? Maybe Dominique, you can help with that translation.
Okay.
Dominique, we can't hear you.
Hello, Dr. Sheikh.
Oui.
Can you hear me now?
Yes.
Allô?
Allô, Dr. Sheikh.
It's very quiet, Dominique.
On n'entend pas, hein? J'entends pas du tout.
Allô? C'est bon? Ou bien?
Allez-y.
Oui, on voulait savoir, il y a plusieurs défis soulevés. Est-ce qu'il est possible d'identifier un et apporter plus d'explications par rapport aux défis à ce qui concerne cette co-création?
Les défis.
Oui.
Oui.
Oui, vous avez soulevé certains défis. Est-ce qu'il y a un parmi ces défis que tu penses que tu peux apporter plus de détails par rapport au ce que tu as présenté comme défi dans ce processus de co-création? Merci.
D'accord.
Bon, c'est certainement clarifié, docteur Anne, ce qu'il veut dire, c'est que vous avez identifié un ensemble de défis. Et parmi ce groupe de défis, est-ce que vous pouvez sélectionner 2 défis, par exemple, sur lesquels vous voulez en tout cas mieux mettre l'accent?
Oui. C'est-à-dire qu'au niveau des défis, j'en avais souligné 4, n'est-ce pas? D'abord, il y a l'alignement sur le plan du gouvernement. Ça, je pense que c'est important pour permettre, n'est-ce pas, que le démarrage précoce, le démarrage précoce, n'est-ce pas, de la lettre d'exécution. C'est-à-dire qu'en début janvier, par exemple, si on pouvait signer la lettre d'exécution, ça pourra permettre donc un démarrage vraiment précoce des activités. Mais il y a également, n'est-ce pas, la disponibilité, n'est-ce pas, d'outils stables acceptés par tous les acteurs. Qu'on connaît des maquettes de planification, des maquettes de vision et des checklists, n'est-ce pas, qui sont stabilisés et acceptés par tous les acteurs. Maintenant, chaque fois qu'il y a, par exemple, de nouvelles informations, que les gens puissent s'asseoir pour pouvoir faire donc le consulter ou bien faire la mise à jour. Je pense que ces 2 points vraiment me paraissent les plus importants par rapport donc aux défis.
Yes. So he said that he thinks that among the list of the challenges, so he thinks that maybe 2 challenges are more important. The first one is the alignment with the country system budget cycle, because this is really key. I mean, to make sure that the implementation letter can be signed on time. The second challenge that Dr. Anne is trying to focus is about the tools. So the agreed tools that will be developed. I mean, in the co-creation. For example, the tool to develop, for example, the annual work plan, the tools that will be used, for example, to develop the budget. So this is really key, because sometimes, I mean, we need to have a consensus, I mean, on the tools that need to be developed before starting the co-creation process.
Great. And Omar, would you add anything from your perspective on both of those challenges, or any other challenges you saw from USAID side on the co-creation?
Yeah, I think that yes, I really agree with the suggestions of Dr. Anne, because I mean the tools that are required for the co-creation are very important. For example, the verification of the milestone. So normally it's very important to make sure that before the validation of the milestone, we agree with our partner government on how the milestone will be measured. Mm-hmm. So, and what should be the criteria? Sometimes we use, I mean to validate this milestone. For example, if we have a outcome-based milestone, sometimes it's going to be very hard, I mean, to go in all the health facilities, I mean, to collect the information. And we need maybe to take a sample. And for by taking the sample, you need to make sure that you agree with your partner, on how the sample will be selected and how, the information will be collected, to measure the performance of this milestone. Over to you.
Great. Yeah, those are great observations. And I think, add to the point that early planning and really talking through all the details is so important ahead of beginning implementation, which can, mean more time, but that time is well spent to ensure that implementation then goes smoothly. Thank you. Another question came in, and I think this is a great question on lessons related to sustainability. And the person writes, many host governments struggle with resources. Any insights into ways to make these programs sustainable? I don't know, both for Omar and Dr. Han, if you could talk about how you've thought about sustainability of the activities and the work that's part of the G2G agreement after the programs end. How do you hope to make them sustainable?
Voilà, docteur Anne, alors il parle plutôt de la pérennisation, donc le défi de la pérennisation des interventions dans le cadre du G2G. Alors, elle veut savoir, est-ce que vous pouvez partager votre expérience sur quoi on doit plutôt mettre l'accent pour assurer la pérennisation de nos interventions? Dr. Anne? So maybe I can jump. Okay, go ahead. Vas-y, Dr. Anne.
Voilà. Donc, par rapport à la présentation des interventions, je pense d'abord à notre niveau, c'est-à-dire que cette facilitation de la mobilisation de ressources, il nous faut vraiment continuer à faciliter la mobilisation de ressources domestiques. Par exemple, qu'au niveau central, que la ligne G2G a permis, n'est-ce pas, par rapport aux interventions là où le G2G ne le prend pas en charge, n'est-ce pas, la ligne G2G nous a permis aux structures, n'est-ce pas, de pouvoir avoir certains types d'équipements. Je pense que ça, c'est quelque chose qu'il faudra essayer de pérenniser. Mais également, essayer de pérenniser, n'est-ce pas, l'utilisation de compétences. C'est-à-dire qu'au moins, on sait qu'au niveau local, on a certaines compétences que peut-être au niveau de notre ministère, on n'a pas pu utiliser, n'est-ce pas? Mais avec le G2G, n'est-ce pas, on s'est rendu compte qu'au niveau des régions, il y a pas mal de structures qui sont là, qui peuvent aider le ministère de la Santé et de l'Action sociale à atteindre certains objectifs, ou bien qui peuvent leur faciliter, n'est-ce pas, à l'obtention de certains équipements. Je pense que c'est au niveau de ces deux aspects, vraiment, il faut que ce sont des choses que l'intervention de l'USAID peut permettre de pérenniser.
So regarding the long-term sustainability of our approach, so he's talking about the importance to promote the mobilization of domestic resources, and this is really challenging on how to incentivize our partner government to codify, line item is in the national budget. So one of our strategy, to support, the government of Senegal to mobilize the domestic resources is first of all to make sure that our really projects are in line with the government with our partner government priority. So it's very important, first of all, to make sure that it is really important. So the second element is to make sure that the Ministry of Economy and Finance is involved very soon, in the process, because they are the key actor, on the domestic resource mobilization. So making sure that the Ministry of Economy and Finance is involved, very soon, in all the process of the preparation can sometimes facilitate the domestic resource mobilization. So the second approach is, for example, the mobilization of resources at provincial level. with the contribution of the local government. Our experience we try, to implement in Senegal is to use the matching grant as a mechanism to incentivize the local government to provide additional resources, into G2G. And the last one is building the capacity of, the actor. What he's saying is that our approach is instead of using the external, for example, consultants, our approach is to use the existing expertise within the government of Senegal to provide technical assistance and to build the capacity of the region. So this is our approach we use, to ensure the sustainability of our project. Over.
Thank you. Those are all great tips, and I think could be a whole webinar session just on sustainability and thinking through those pieces. Thank you for sharing. I don't think we quite addressed, how long the process takes, and if you could estimate, as you've been going through the design and co-creation process, how long did the sort of design phase last? How long did it take to do this co-creation process?
So in Senegal, so the average of this co-creation is around 6 months. This is the average.
Great, that's great to hear. I know it can take more and it can take less, but I think that's great to hear a range. The 6 months is on average, and I'm sure as you and the government in Senegal become familiar with the process, it can move faster, right? And the first time it probably took a little longer.
Yes, exactly.
Any other questions? I don't think I have seen any other in the Q&A box or in the chat box, but if there are any other questions, please raise your hand if you'd like to ask them live, or put them in the chat box or Q&A box, and we can address them in the last few minutes we have. I think I see one person talking about a question on environmental risk and compliance. How have you thought about environmental risk or compliance as part of the co-creation process? Was that at all included in your co-creation?
So normally the environmental compliance come up during the post-award meeting, because this is the opportunity during the post-award meeting to share with our partner government the requirement on the use of the US government resources. For example, it's not only the environmental compliance, but we have also, for example, the family planning compliance, because in our mission, for example, we are using, for example, the FP funds, into our G2G, and we have, to make sure that, the requirement related to the FP are really taken into account. And overall, we have also regarding the UAT requirement to comply with the environmental USAID requirement, and this is said during the post-award meeting.
Great, and I see Brad, you have your hand raised if you want to. We'll unmute you, and then you can ask your question.
So maybe Debbie, so I have also my colleagues from the health office who are here. We have also Abdurrahman. So if you have anything to add, so I think that you are welcome.
Yeah, am I audible?
Yes.
Bon, je peux poser ma question directement à Dr. Han.
Oui.
Vous avez discuté un peu de la participation des partenaires techniques et financiers au niveau régional. Est-ce que ces partenaires ont eu aussi un rôle à jouer au niveau central, du point de vue de la mise en œuvre de cette coopération?
So you are talking, Dr. R, about the participation of the donor at the regional level. So you are asking if, for example, these donors have also to play a key role at central level.
Je peux?
Oui, allez-y, Dr. R. Oui.
Voilà. C'est-à-dire que il y a certains partenaires. Par exemple, si je prends la région de Kaffrine, par exemple, il y a la coopération luxembourgeoise qui est là-bas. Mais c'est-à-dire que cette même coopération luxembourgeoise intervient au niveau de la région de Kaffrine, n'est-ce pas? Il y a la coopération japonaise qui intervient au niveau de la région de Kaolack. Mais ces deux partenaires, n'est-ce pas, sont presque logés dans la direction de la planification et de la recherche et des statistiques. Ce qui fait que, si bien ils sont avec nous au niveau central, mais également, c'est la même direction, n'est-ce pas, qui les accompagne au niveau de leur intervention dans ces régions. Donc, c'est le même partenaire, aussi bien au niveau des régions qu'au niveau central. Il faut déjà, ils sont au niveau central, au niveau du stratégique, mais également au niveau opérationnel avec les régions et les districts. Si je prends l'exemple.
Yes, so exactly. So the partners are also involved in the co-creation at regional level as well as at central level. And most of the donors, for example, the Luxembourg Corporation and the Belgium Corporation, they have their office at the direction of planning and research and statistics. That's why, I mean, during, for example, the validation of the milestone, for example, at central level, all these donors, I mean, participated to this process. Over.
Great. And I think, Abraham, you had a comment. Do you want to jump in?
Yeah, yes. Hello, everybody. This is Abdourahmane Danlo from the Program Office USAID Senegal. Just to come back to the issue of sustainability, and how we're really addressing that. First of all, in the case of Senegal, the issue of sustainability is addressed at the DOAG level, at the bilateral agreement level, and we have 4 of them. And if you look at our bilateral agreement we signed with the government of Senegal, this point on domestic resource mobilization is very, is really highlighted then there. And also, there is, this point on the alignment of the government with the government priorities. And that is also very, strong and well highlighted in the DOAG. And finally, the reforms. For the first time, we have included in our bilateral agreement with the government of Senegal the reform, because we know that one thing is really to implement activities, but if you want to sustain the activities over the time, they have to be supported by really implementation of reforms. And some of the reforms, as Dr. mentioned, are really PFM related, but others are really technical. So that's also something that we're trying to really reflect in the G2G process when we are doing the design and the preparation of the implementation letter. And we learn a lot from the health experience, and we have really extended the G2G line item that the line ministry have in the budget to other sectors like water and sanitation, education, the sector where we are doing G2G, so that the funding will be progressively supported by the host government. And this is why, we're really putting a lot of emphasis on the domestic mobilization. And in a nutshell, this is our plan for really ensuring sustainability. Over.
Great. Those are great reminders. And I think big picture, how to move forward and how to ensure the reforms are in place so that there's sustainability long-term. I think that relates to some degree to Janine's question that she put in the chat or the Q&A box on how has the work related to systemic improvements in the PFM system. I think we are at time though, so I'll ask that maybe we can reply to that question, Janine, on a follow-up written response. But I want to make sure we end not too late. So thank you all so much for your participation. A special thanks to our colleagues joining from Senegal, and for our translators who have helped, especially Omar, jump in at the last minute to help with translation too. These have been really useful tips and perspectives to hear, and I hope you all have found them useful. I have a lot of thoughts on follow-up and would love to see some of the resources and tools and examples that you all have shared. So we will be following up. But thank you all so much for your participation. And we look forward to having you join for our next session that will be announced the date, but on implementation lessons coming in the next few months. Thank you all and have a good rest of your afternoon, morning, and evening.
Oh, thank you so much. Thank you, all of you. So,
Thank you so much.
Merci, merci Omar, merci à tout le monde.
okay, merci, Dr. Anne.
Thank you. Goodbye.